delivery or is through cesarean section? Can you hear me? Please, can everybody hear me?
Yes, loud and clear.
Okay.
Yes, we can hear you.
Okay, so whether it's through vaginal delivery or it's through CS, safe delivery is what matters. A mother's strength is not defined by how she gave birth, but it is defined by her love and by her sacrifice for her child. Even let me add to this, even there are some, there are some couples that we've seen that the man is the one that will say, okay, no, I don't want CS for my wife. And that is because of the belief of, she has to go through this to show her strength. Nothing like that. The most important thing is safe delivery for the woman and for the child. Now, the female sexual and reproductive health, there are many cultures that discourage women from discussing about contraception, believing that contraception promotes promiscuity. Now, there are different reasons why a woman would use contraceptives. Contraception is not only, those contraceptives is not only to prevent pregnancies. There are some conditions that a woman would have, and she needs to take contraceptive pills. It has different functions. Contraceptive pills can regularize menstruation for those, for women that have irregular menstruation. If a woman has PCOS, contraceptive pills can help with PCOS. If a woman has fibroids and, bleeding heavily, because, one of the symptoms of uterine fibroid is heavy bleeding. That's actually one of the first most important symptom, heavy bleeding. Contraceptive pills can help regularize that. No, don't get it wrong. Contraceptive pills cannot take away the fibroid, but that symptom of heavy bleeding, contraceptives can control it. Endometriosis, contraceptives can control it. So if a woman is taking contraceptive pills, it does not mean, she's trying to get pregnant, she's trying to avoid not getting pregnant and she's promiscuous. That entire belief is false. And so a woman can take contraceptive pills for several different reasons. Yes, there are some that take it to avoid having a child as well, but for the most part, the belief of, you're on contraceptive pills and you must be promiscuous is wrong, is a false belief. So scientific reality around that is women have the right to understand and manage their reproductive health. Family planning, like I said, yes, to avoid giving birth for those for couples that maybe you've given birth and they encourage family planning. Why do we want to? With family planning too, there is different form of contraception basically that they give them, whether it's pills, whether it's injection, whether it's devices that you use for your contraceptive method. It does not really matter. Family planning is very important to prevent complications from closely spaced pregnancies. Now, this simply means, a woman gives birth this year, 2025. We won't expect that she wants to get her next pregnancy is in 2026, because pregnancy in itself is something that can change the body, and it's a situation that can also take an amount of toll on the body. So we want the body to heal properly, to heal to an extent before you start thinking of getting pregnant again, because there's different physiologic change that happens in the body, and we want you to heal from those physiologic change before you want to get pregnancy again. You want to get pregnant again, and that's where family planning comes into play. And that's why it is encouraged that, family planning. If you go to the hospital, you would always see a section. Mostly, if you go to maternity hospitals, you will always see a section. Family planning is basically contraceptives that they give them, and these contraceptives for them is to help with child spacing. But apart from that, there's still other use of contraception, which women don't really like to talk about, simply because of the entire belief attached to contraception, thinking a woman is promiscuous. The next thing I'll be talking about is breast and cervical cancer myths. Some people believe that breast cancer happens to only older women. This is not true. Now, with cancer, there's two types of cancer. It can be benign cancer or it can be malignant cancer. Benign cancer simply means it's not a bad cancer. That's the simplest term I can use so you understand. Benign means, it is good, they can remove it. Like that cancer is curable, while malignant means it can have a a bad effect on the body. Those the type of cancers that kill, they are malignant cancer. Now, the entire idea that breast cancer can only happen to older women is not true. And this is why breast examination is encouraged. You will tell a girl, a woman, everybody is encouraged to do a breast. It's even very important for a girl to know how to do breast examination on herself. You don't need to go to the hospital for them to do it for you if you know how to examine your breasts by yourself. This is simply because a young girl, age of 18, 17, 19, we've seen they will come up small lump. It will always start like that. It will start with one small lump in the breast, and this is why breast examination is very important. So because of this belief that cancer can only happen to older women, older people, breast cancer is, the thing is, yes, it is common. It's common in older people, doesn't mean it cannot happen to younger people, younger ladies. And so they neglect self-examination, self-breast examination, they neglect it. Some people think cervical cancer screening, that is pap smear, is unnecessary unless the woman has symptoms. This is very false. Now, as long as a woman is sexually active, it is very, very encouraged to always do pap smear. Now, this is different with age. For women that, you're sexually active, regardless of your age, the moment you're sexually active, you are expected to go for your pap smear. For younger ladies, if you're between the age of 18 to about 35, you can do it every 5 years. You can do pap smear every 5 years. For, older women, say from 35 to 65, is encouraged that you can do it every 3 years. But from 65 and above, is encouraged every year that you do your pap smear. It is encouraged. You don't wait till you have symptoms. How cervical cancer is that cervical cancer, the moment you're already having symptoms, is already bad. That's the thing. You're already in stage 3, stage 4 cancer, not you, sorry. The patient is already in stage 3, stage 4 cancer the moment you start seeing symptoms. And the thing about cervical cancer is if they catch it early from pap smear, if it is detected early, you can cure it. But the moment it's already stage 3, stage 4, there is no cure. There is no cure for the cancer. And that is why it is very important and very encouraged to always do your pap smear. The moment you're sexually active, you don't need to have any symptoms. Just go. You're sexually active, go to the hospital, request that, you want to get a pap smear. If the result is normal, good and fine. Young ladies, the next time you want to do it, 3 to 5 years, do it again. You do a pap smear again. So yes, for breast cancer, ladies neglect breast examination, and for cervical cancer, they thought that until you have symptoms, go and do the test. That is wrong. So early detection, like I mentioned, early detection of breast and cervical cancer can save lives. Just even breast, if they detect those lumps early. And for breast cancer, even like if they detect those lumps, even if that lump was supposed to grow to be a malignant cancer, because of that early detection, it can be cured. It can be cured. But the moment it's not detected early and it is allowed to advance, then there's only so much that can be done. So early detection of breast and cervical cancer screening can save lives. Women should get regular screening without being afraid or without the fear of stigma. And that's why you'll see some outreaches. They just do free breast cancer screening, pap smear, free pap smear screening. You will see several outreaches that do something like that. It is very encouraged. Infertility and childbearing myths. Now, there are societies, even in Nigeria, you go to a lot of places and you would find them blaming women only for infertility, even though male infertility is just as common. This is very rampant. I worked at Lagos Island Maternity Hospital, and it is you would find women coming to the hospital only alone because they are looking for a child, they've not been able to give birth. The first thing the doctor will say, where is your spouse? Because it is not only because of you that you might be unable to give birth. There is also male infertility. And it is very, very common as well. It's not just the woman. Yes, there's different, there's different causes of infertility in the woman, whether it's from your ovaries, that's, the place where the egg is, whether it's the pathway that the egg is supposed to pass, that's the fallopian tube, or whether it's just the womb itself that, is unable to keep the baby there. There's different pathways, there's different causes of, the infertility in the woman, but it's the same thing as the man. The sperm that is supposed to fertilize the egg, if the structure of the sperm is bad, like the structure is shaped, like the shape is deformed, it will not properly fertilize the egg. If the quality of the sperm is not good, it will not properly fertilize egg. If the motility means like the movement of the sperm, the sperm is supposed to get to the egg. If the motility is not fast or is not good, it's slowing down the sperm would die before it gets to the egg. And so there's a healthy egg waiting for a sperm to fertilize it. But then the sperm, there's different things like the bad motility or bad structure or bad quality. All of that is affecting the sperm from getting to the egg. The egg would not be fertilized, and that would lead to infertility. And the same thing for women too, like I mentioned, whether it's a pathway problem. There are some women that they've even given birth before, and they're unable to give birth to a child again. That one is secondary infertility. Primary infertility is those women that they've not even given birth at all in their life. Secondary is those that have given birth, but they cannot have children subsequently, maybe due to one reason or the other. So that's it. So infertility can be male or female cause. It is not just the woman's fault at all. So there's that belief that the moment a woman is not able to give birth, you will find households where they will say, I'm going to marry another wife, I'll get another person to give me a child. When it can be from the male and from the woman on equal grounds, not that anyone is higher than anyone, on equal grounds. Women who struggle to conceive are often labeled as cursed or told that they must seek spiritual deliverance. Usually, you just need to come to the hospital and get the woman and the man. They just need to come to the hospital and get the proper assessment done. They get the necessary important examination. They get it done, and so whatever is found on investigation, they would know how to move forward, depending on the cause that is found to be what is causing the infertility. Now, the scientific reality behind it is infertility is a medical condition, and you'll be surprised that infertility is a common medical condition. I remember when I was in school, and I just got to obstetrics and gynecology. Gynecology actually. The first topic is infertility. Is a very common topic because it's a common case. Even when I was at Island Maternity on our gynae clinic days, infertility, it is very common. And so because of this commonness around it, it is very important that the man and the woman should check themselves. It's not just the cause of a woman. Infertility is a medical condition that can be treated in both men and women. Blaming the women alone is unfair and it is very incorrect. So the next one is female genital mutilation and harmful practices. There are many communities in Nigeria that still practice female genital mutilation because they believe that it preserves purity and prepares a girl for marriage. This is very, very, very wrong. And I'm so happy that there are some places that this entire female genital mutilation has been abolished, because there's no significant use. There's no one benefit of female genital mutilation. It just causes pain. That's the only thing with female genital mutilation. There are some people that the female genital mutilation, some people believe that it is what do they call that thing? Female circumcision. So the way a boy is circumcised, some people think a girl should be circumcised as well. That is entirely wrong. That entire belief just leaves the girl in lifelong trauma. With female genital mutilation, you can never, or the lady, the girl would never have pleasurable sexual intercourse because of that pain. Because of that pain, sexual intercourse would never be pleasurable during marriage. Never. The pain would still be there. And it can also, when a woman wants to give birth, there can be complications. One of the popular, most important complication, also infection. With female genital mutilation, the risk of infection is very, very high. And this is why even during pregnancy, and remember from the genital mutilation, there's already risk of infection. And if infection itself can affect pregnancy. And that's why even a simple condition like malaria in pregnancy should be taken very seriously. So now imagine there's already infection before even getting pregnant. That pregnancy is coming to meet infection. It's just a disaster about to happen. There is no single benefit for female genital mutilation, and it should be abolished everywhere in the world. Everywhere in the world, it's not something that should be encouraged at all. So female genital mutilation causes severe pain, it causes childbirth complications, it causes infection and lifelong trauma. The scientific reality behind it is female genital mutilation, it has no health benefits and it should be completely abolished. So now what can we do as health professionals? It doesn't even have to end with health professionals. Even as an individual, from secondary school, universities, it is something that should start being discussed. All of the above that has been mentioned, these are topics that should start being discussed and it should start being encouraged. The first thing we want to do is to educate ourselves, and we should educate other people. And that is why I'm very happy that we are having this webinar today, because it is very important to, get the right knowledge. Because, there are some people that have knowledge, but the knowledge itself is wrong. So get the right knowledge and also inform others, encourage others, tell other people about these things. These topics are very interesting topics to talk about. So knowledge is power. We must seek accurate information from doctors and not just cultural traditions or cultural beliefs that has been passed down from generations to generations. The best thing we can do for the generation to come is to pass down the right knowledge, is to pass down the right information. So another thing we can do is to encourage open conversations, like what we are doing right now. It's something that can happen in our households. It would always start from home. Let's start from home. Let's tell our kids, let's tell our sisters, let's tell our brothers, even our parents self, we can tell them, no, it's not like that though. It's not like that. This is how it is, and this is why it is like this. Our friends, our neighbors, let's tell everybody. Let's talk about these things. Families should talk about women's health without shame. It is very normal. These things are natural processes. Even all these things I mentioned, in Islam, with menstruation, women are, excluded from, fasting and praying. But this doesn't mean that, the woman is unclean in a disgraceful way. Menstruation is still a normal process in this, in religion, and even with Christianity. Menstruation, childbirth, all of these things is a blessing. And this is just me just trying to chip in the, religious aspect outside of the medical aspect. Religious aspects, these things are blessings. This thing is a natural process that is encouraged. So why should we not talk about it? Why should we not promote it? So families should talk about women's health without shame. Mothers and fathers, they should educate both their sons and their daughters, and educate your neighbors, educate your friends, tell everybody about it. So we also want to empower women to take control of their health, seek rather than traditional birth attendants, for pregnant women, or rather than herbal medications. Because of that shame that, some women will be scared to go to the hospital. Because I've worked in the hospital and I've seen some women come late to the hospital simply because they were scared to come to the hospital. They relied on herbal medication because they thought that was the right thing to do. And this would only make a complication worse. This will only make that particular symptom get worse. And by the time you're coming to the hospital, you're coming at a late stage where there's only so much that can be done. And so that is why we say these things that we've mentioned, it affects the society. It's not just women. It affects everybody in the society. So we want to encourage women to feel confident to seek medical care and make informed decisions about their bodies. So another thing that we can do is involve men in the conversation. And this is such an important point. It's such an important thing because it's not just involving men in the conversation, it's also educating the men to know the right thing. Men discouraging women from having CS, or men encouraging women to, herbal medication is better. All of these things is false. So we want to encourage men. We want to bring them into the conversation, because they play a crucial role in supporting their wives, their daughters, their sisters. An informed man can be an advocate for women's health and rights. And this is extremely important because everybody needs to be involved. It's not just women. Everybody needs to be involved, and with the right education, with the necessary education and equipment, we can do all of these things. So advocate for better healthcare policies. We need affordable healthcare and stronger laws against harmful practices like female genital mutilation. And apart from healthcare policies, even the necessary, we should advocate for the necessary equipment to also address these matters. Equipment, education, promote outreaches, basically anything that is going to teach, anything that is going to improve the health of women is something that should be advocated for, is something that should be encouraged. Because in the long run, everybody benefits. In the long run, everybody knows the right thing to do. In the long run, the health, bad prognosis can be changed to good prognosis with early detection of these things. And with early detection, it will always start from knowing the right thing. It will always start from knowing the right step to take. So, in conclusion, breaking the silence on women's myths and taboos is not just a woman's issue, like I said, it's a community issue. By replacing these myths with truth, silence with open conversation, and shame with empowerment, we can always create a healthier and more informed society. So, I would want all of us to commit to being part of this change, and may God bless and guide us in our journey towards knowledge, towards health, and towards equality. Thank you so much. Thank you so much. I really liked this topic. Let me
Thank
go
you
back.
very much, Dr. Halima.
Okay. You're
Yeah.
welcome.
Thank you. Thank you very much for this insightful topic and the lessons that you've taught us today. I really learned a lot from all you said, and I'm sure everyone on this program has really learned a lot and have changed their mindset. We all have an important female in our life, be it our mom, our sisters, our niece, our cousins, our grandmas. We all have one female or the other that is very important in our lives, and I'm sure with this information we can educate them more and make the female gender a better gender generally. Our next stage now is for questions, and because this particular um, topic is an interactive topic, so we'll be entertaining questions, like you ask your questions by yourself physically, like turn on your mic and ask your question. So in the next 5 minutes, we'll be entertaining questions since it's an interactive section and a very interesting topic. So please, if you have any question, you can just wave, and then once I call out the name that is displayed on my screen, then you can unmute yourself and ask your questions. We'll be entertaining as more questions that we can have, but we have just 5 minutes for questions so that we can round up. So please, if you have any question, you can just raise your hand. Okay, I can see Jenny Okonkwo. Her hands are raised, so you can unmute yourself and ask your question briefly. Thank you very much. Hello. Okay, while we are waiting for her, if any other person has a question to ask, you can just raise your hand, then I can so that we can have a question. Does anyone have a question?
I think there's
Okay,
some hands
so
raised.
okay. We have Elizabeth Odiemi. Please can you go ahead with your question?
Hi, Dr. Alima. Good afternoon, and
Hello.
thank you so much for that section. So, this is the main question I want to ask. I know you talked about the myth of having a cesarean section, and yes, I know there is more awareness about it. People saying, "Oh, if you give birth through CS, they believe that women are lazy." And if they actually give birth through vagina, they are very strong. And how do we even correct this impression? Because I realized I was speaking to some group of women some times ago. Even to them, they believe having CS is being a lazy person. How do we correct this impression? Yes, I know you provided some like speaking out, having education or having webinar like this, but for women that have this mentality, how do we correct them? How do we speak to them that it's safe the baby that matters most?
Okay, thank you, Elizabeth, for that question. Usually, you would find that most of the women that talk of that say, "Oh, cesarean CS is for women that are lazy," you would find that most of them they gave birth through vaginal delivery. And so, if you peradventure find yourself around, a woman that has never gone through CS and she's talking about, "Oh, CS is for women that are lazy," the first question you can ask her, and this is just, it's no confrontation, it's no fight, it's just simply, let me understand your thought process to why you think CS is, for lazy women. First question is ask her is, okay, if you have a high risk pregnancy, there's different causes of high risk pregnancy, say hypertension in pregnancy, say diabetes in pregnancy, say some type of infection in pregnancy, or maybe your baby needs to come out at that point in time. Your baby can no longer stay in the womb and needs to come out. And the option to opt for is CS. Ask her, you can ask her, what would you choose to go for? If the life of your baby is at risk or your life is at risk, will you still choose to not go for the CS? That's the first question to ask. Because at the end of the day, the most important thing, like I said, is safe delivery. So what is the entire strength, whether it's for lazy women, whether it's not for, the point is the baby is fine and the mother is fine. That's the entire point of pregnancy. And so it's really just honestly, like, it's a mentality. We have to talk about it, like I said, educate, advocate, because that's really what we can do. Some people are just ignorant. There's only so much that you would say until they are in that position, they experience it themselves, they will only keep talking. There are some women that they've said, "Oh, I'll not do CS, I'll not do CS," and they needed to do CS and they went for that option. Because, see, the thing is, it's not like they're afraid of the entire idea of surgery. They are just It's just the entire idea of not giving birth properly, or not properly, not giving birth through the normal way. That's the mentality behind it. So it's not like they are scared of surgery. Some people are scared of surgery, say, "Oh, is my life at risk? Oh, the complications that can come from surgery." That's a different case if you are scared of surgery in itself. But for most people, it's just the entire idea of, "Oh, you'll be termed as lazy, or you will be termed as less of a woman." So it's a mentality thing. And so there are people, these people, until they are in that position where their lives or the lives of their babies are at risk, then they would know that it's real, and then they would know that all that matters is safe delivery. CS is just a type of surgery. It's just a surgery for the for you to give birth, or for one to give birth. CS is just a surgery. So there's only, when it comes to ignorance, there's only so much you can do. Even after, because there are some people that even after educating them, they would still not agree. They would still not agree. They would still just rather remain ignorant until they are in that position. So with ignorant people, there's only so much you can do. However, there are some people that are not ignorant. They just don't know that CS is also a normal way, or CS is also a highly recommended way for a woman that needs to do CS. If a woman does not need to do CS, you would never see a doctor asking you to do CS. Never ever. You won't. Because one, with surgery in itself, there's several complications that can come with just doing surgery. Number two, doctors would always want to go for the cost-effective one. CS is not exactly cost-effective. Normal vaginal delivery is less expensive than CS. And so a doctor would not want to waste your money. So you would never see a doctor recommending CS when you don't need CS. It will always be vaginal delivery. But then if you need CS, they would always encourage CS. And so with women that are just ignorant, you would find most of them have never actually done CS. Most of them. And for those that had that mentality shift, or for those that maybe did CS, you find them saying, CS is no, there are some of them that they will even want CS again. They would rather do CS again rather than normal vaginal delivery. Simply because of how, CS is very stress-free. You are asleep, they just bring out your baby. It's stress-free. It's just the pain that comes with, post-surgery, those ones that you have to, treat and stuff like that. But apart from that, there's no, all of the, pain of labor, there's nothing like that. So yeah, I hope I've been able to answer your question.
Yes, Elizabeth.
Yes, you did. Thank you very much.
You're welcome.
Okay. Thank you very much, Dr. Lima, for that. We have a question on the inbox, so I'll just read it out. I have noticed my hand always gets swollen every month before my monthly flow and during. Sometimes both arms and both palms and arms, or just one, my upper arm region, my feet, even my face and lips and other parts for every month. It chooses the spot that would be swollen. I suspected it had to be like a premenstrual syndrome because I've been taking record of the occurrence. But then I want to know if that's really the cause or there's something else.
Okay, for whoever asked that question, that's something that, first of all, I would need you to go to the hospital for, but before then, because if I say I want to answer your question, I'll start asking you questions. How old are you? When did you notice it? Have you been noticing it from the first time you saw your period? Whatever age that is, maybe when you were 12, 13, is that when you started, or it started at a later age? So how long have you been noticing this symptom? And is it every month? So in a year, you notice it 12 times before your symptom. If that is the case, then there is a pattern. You can see that, okay, this thing only happens when your menstruation comes. And does it regress after your menstruation? Or does it still remain even after your menstruation? All of these things we would want to know. So, but if it's a case where it comes before your period and leaves after your period, yeah, you can now kind of, it puts you in a box of, okay, it could be premenstrual symptoms, since it's something that comes right before the period and leaves after the period, and it doesn't come at any point in time again. We also want to know your family history. Is there any other person in your family, any other lady in your family that also has the same thing, also around that same period of time, before and after a period? Your mom, your grandma, did they have these similar symptoms? Do you understand? We want to know that. But if it's a case where it is not, it does not go after your menstruation, or it was not there before, it just suddenly started, it could be something else that is, causing this thing, and it is just coming around your menstruation coincidentally. And so in that case, we are talking about, leg swelling, arm swelling. I want to know your age. You understand? I want to know what you've been taking. It could be something related that is outside of menstruation, and it's something that I would definitely recommend that you go to the hospital to get assessed. So what you want to do, you want to ask your siblings as well, your female siblings, ask your mom if they have that symptom. You want to take notes and actually properly take note of the pattern. Does it come right before your menstruation comes and leaves after your menstruation. All of those symptoms, it ends after your menstruation. You want to take note of those things, because if that's now the case, yes, we can just generalize it as, okay, it is, sorry, we can put it in that box of it's premenstrual symptom and it is because of your menstruation. And I would even want to know, how it is while you're menstruating and how your menstruation is. There are some people, their menstruation is so bad that they get admitted. And there are ladies, they have, there are different types of symptoms before and after menstruation. This is only normal. And because it's happening, menstruation in itself is another physiological process that the entire body goes through, all of the hormonal changes and stuff. So all of these years can come into play, and it's very different in ladies. Some ladies feel nothing, and it's just a lot of things that happen in another lady, and you'll be like, what is the difference? You understand? But it's just different in people. So I want you to take note of this pattern before and after your period. I want to know if there's a family history of the same thing that you're having. I want to know how long it started. Do you understand? So if you're able to put these dots wherever you are, if you see that it's not, it is still present without your outside of your menstruation, I would advise that you go to the hospital. But even at that, if it's something that is really bothering you, you might not necessarily take note of all these things that I've mentioned. Go to the hospital, but just know that these same questions I've asked you is something that they would also ask. So you want to have answers to this question as well. But most definitely go to the hospital. Anything that has to do with swelling, all of these are pretty important symptoms, and you want to get yourself treated.
Thank you very much, Doctor, for that insightful response. I believe whoever sent the question, you've answered the question, and the person should kindly book an appointment to actually get the underlying cause of the symptoms she's having. I would like to kindly ask that you sit back and enjoy a little clip that I'm about to play before we round up for this episode. Thank you.
Can you imagine a world where you could easily access medical consultation from your smartphone? My Medical Bank is your one-stop online platform that allows you to book healthcare providers at an incredibly affordable rate. We offer services such as home care, telemedicine, clinic visits, EMR, PHR, health market, and health jobs. Subscription is free. To register, visit www.mymedicalbank.com or simply download My Medical Bank app. Think health. Think My Medical Bank.
Thank you very much. From the short clip, I just want to introduce My Medical Bank. Just let you know what we actually do, the services that we provide, and you can book us whenever you need such services. Starting first is our telemedicine. Okay, so we have My Medical Bank has an app where you can actually book for sections. You can actually book our doctor. You can book our beautiful doctor that just spoke to us today. You can consult her whenever if you have any symptoms, whatever you might need to speak to a doctor for, you can actually book an appointment on the app. You can actually also record your personal record, your reports from the hospital, so that it doesn't get missing. It's actually a very private app where you can actually record whatever documents that you want to record. You can also set reminders for your medications. You can set up reminders for your medication so that you don't miss your dose and miss your medications that you need to take. You can also use the app to book for your medical visits for if you need health workers to visit you, be it doctor, physiotherapist, or a nurse to visit you at home. You can also make use of the app to book for those services. You can also use the app to book for living carers. You can also access medical consultation, your hospital appointments, and all of that. The next service I'm going to go into is our HCAT training, home care attendant training. My medical bank offers home care attendant training where professionals come in to train people that want to go into home care attendant, going to become carers, and support other people who need love, care, and support and companionship. You can come in for our training by professional trainees, and our certificates are globally recognized. Our next service I would like to go into is our home care service. Our home care service where you actually can actually book for carers to come in to provide care and support for your loved ones at home who need care and support at home. The next one is our health packages. Our health packages are exclusive and customized health diagnosis packages that we offer by credited centers, lab centers, wherever you are in the world, wherever you are in Nigeria. We actually offer those services. You can book us, and we can get the test done for you. We also have pre-employment packages. We have the mother and child packages. We have the mental health packages and all of that. You can go to our website at www.mymedicalbank.com to book all those services. We also offer health jobs where you can actually get links of health jobs that you might want to apply for and all of that. Thank you very much for joining this section. If you are just joining us for the first time, like I said, thank you very much for bringing out your time to attend this webinar. I don't know about you, but I really learned a lot and I enjoyed myself in this section. If you are a returning audience, thank you very much for being an OG and attending our continuous webinar. I'll see you next month with another interesting topic. Same time next month. Thank you very much, everyone, and enjoy the rest of your weekend. Don't forget that when you think health, you think My Medical Bank. Thank you very much.